Did you know migraine is the least publicly funded neurological condition compared with its economic impact? Let's raise awareness together. Welcome to the Heads Up podcast, brought to you by the National Migraine Centre, the only UK charity treating migraine and headache.
Hello, it's Dr. Jessica Briscoe and I'm here with Dr. Katy Munro.
Hello.
And today we're talking about triptans, so all you need to know about triptans.
Yep, we're going to cover everything, aren't we, Jess?
Yeah.
So, first of all, triptans. Many of you will have tried them, but quite a surprising number of people who come to the clinic haven't even heard of them and don't know what they are. So do you want to start us off?
Yeah, so triptans were developed probably about 25 years ago now.
Yeah.
They were the first specific migraine painkiller, and they work on the serotonin system. So we know that serotonin is one of the neurotransmitters that's involved in the migraine cascade. So they actually work to target that to cause some pain relief during migraine.
And they really have transformed some people's lives.
Yeah.
They were a big breakthrough when they were first invented. The first one invented was sumatriptan as an injection.
Yes. Since then, there are now actually 7 triptans, which is another thing that often surprises people.
Yes, they haven't always heard about them, and they don't realise that if they have tried one and then they haven't liked it, that it's worth going through some of the other ones and seeing whether one suits them better. So just starting off with sumatriptan, we know that it was originally an injection, and you can still get it in injection form, and some people do, but probably more frequently people take it as a tablet.
Yeah, it is also available as a nasal spray, which tends to be quite useful in people who have a lot of nausea or vomiting, so that they feel that they can't take a tablet.
Yes, and nasal spray formulations can be quite useful if you want a quick-acting nasal spray. The downside, I found, is that they taste quite revolting. So sometimes that can be a problem if you are feeling quite queasy.
Yeah, because that can actually make you sick in a lot of cases. And some people say that that's worse than feeling sick from taking a tablet. And also, interestingly, just because it's a nasal spray, it's not all actually absorbed intranasally anyway. A lot of it's actually swallowed. So people sort of say it must be faster because it's taken intranasally. Actually, you still swallow it. So in your stomach that's not working properly, it won't necessarily be faster.
That's true. So sumatriptan, because it was the first one that we had available, when it became a tablet, people could take 50 milligrams or 100 milligrams as a starting dose, and we now know that the maximum daily dose is 300 milligrams, and I often find people haven't been told that.
No, I mean, it's quite a big dose actually, 300 milligrams.
They come in packets of 6, so that's actually a whole packet. And not many people want to take 6 tablets.
No.
Because they really have given up on it by then, and they also come with a warning saying if it hasn't worked, then don't take another one, and people get quite confused about that, I think.
Yeah, I think sometimes people are just sort of given the tablet, say, this is for migraines, sort it out yourself.
Yeah, so if sumatriptan does work well for you, it is fine to take a maximum of 300 milligrams in a day, but you are going to have to get quite a lot on prescription from your GP. And there are really probably some stronger ones available, or ones that may work more specifically for you as an individual.
Yeah, so I mean, when we're talking about the different types of triptan, I think we tend to split them into ones that work quickly and ones that are a bit more slower acting. So the choice of it all depends on your type of migraine. So the fast acting ones, probably the 2 that I use more commonly apart from sumatriptan, are zolmitriptan and rizatriptan, and then there's also elatriptan and almatriptan as well. And
the rizatriptan and zolmitriptan have those melt formulation tablets, don't they? So that some people really like those.
Yeah, again, people often think that mistake the fact that it's dissolvable to think that it actually gets absorbed in the mouth. Again, it still all goes down to the stomach. But if you are someone that gets quite queasy during attacks, actually taking something where you don't need some water, so you don't have to have a big volume on board, you can take it when you're out and about, works quite a lot better, I think, than taking sort of a normal tablet.
They're quite handy for those situations where you need rapid relief. And I think the other thing is about which formulation. It's sometimes appropriate to have a quick-acting one. If you're in a situation, say you're going in to give a presentation at work, or you need to be back functioning very quickly to go and pick your kids up from school or something like that, then a rapid onset triptan can be really helpful. But actually, they are also quite short acting, and so you may need to repeat the dose.
I think that's really important, as you said, being feeling confident enough to repeat the dose again. Usually about 2 hours for the fast-acting ones if you're finding that the symptoms have worn off.
I think all the triptans say you can repeat after 2 hours, but people get a bit worried that they're going to overdose on them or take them too often. So be confident that it is in the product licensing that they can be repeated later on in day one, and it's better to get on top of your migraine on day one than to take a triptan on day one but then have it return and the migraine is kicking off again on day two, and then you have to take another one, and then on day three and it hasn't really gone. So hit it with everything you've got on day one is my motto.
And then they've got the slower acting ones, so naratriptan, which I think people are prescribing more because they think it's weaker. It's not necessarily weaker, it's just a slower onset. It lasts in your bloodstream for a lot longer, which means that it's good for those migraine attacks that are a bit longer, but it won't hit you quite so quickly.
Yeah.
So you get a slower release of the medication. And then Triptan, which I think is your favourite one.
Well, personally, it's my favourite one, but I also think it can work very nicely. It does take a while to work, though, so you have to warn people that it's going to probably take about an hour to an hour and a half to build up and work for their particular attack that time. But then it will still be there, keeping on working over the next 24 hours, where some of the others will wear off after 4 to 6 hours, and you definitely need to go into repeat those. But Triptan is quite useful around menstrual migraine as well.
So it's not licensed for use in that, which means that that's not what its original purpose was. But there have been some studies actually which showed you could either use Triptan or naratriptan, but Triptan came out as more significantly effective. So usually with menstrual migraine, you start treating it 2 days before your onset of migraine, so usually about 5 days before your period, and you take it regularly for 5 days, and it can actually work as a mini preventative.
It can be really helpful in that way, can't it? And also I don't know if this is just my gut feeling, but I think the ones that are quicker onset, sometimes people get slightly more side effects.
Yeah.
And side effects can be a little bit scary with triptans if you do get them. So one of the known side effects is a feeling of pressure or tightness of the chest. And if you're not warned about that, then people sometimes think that they're having a heart attack. I personally took a fast release one once and thought I was going to collapse. It was really quite scary. And I theoretically knew what I was taking, but so you may, because it goes into your system more quickly, you may get side effects more quickly. But having said that, what I think is the big message about triptans is that it's worth trying different ones, because individual triptans have very different properties and individual people react unpredictably to different triptans. So we generally say work your way through them until you find the one that suits you best.
I also think it's worth not just giving up after one dose of triptan. So if you've tried it for one migraine, the advice is to usually try it for at least 2 migraines, because you may find that you've taken it a bit later in one attack and that's why it hasn't worked. So try each triptan at least twice.
When you're talking to your GP about getting a triptan on prescription, one of the factors that we come across a lot is the cost. So they do vary widely in cost. You can buy sumatriptan under the brand name of Imigran over the counter, but I think they only sell them sort of packets of 2 and they're quite expensive. Sumatriptan was the cheapest one. I'm not sure if it still is. I think the price has changed on that. But some of the others are really quite expensive. And the other problem recently is, as with quite a lot of different medications, there have been some supply and availability problems. So people who are used to taking one triptan have suddenly found that they can't get that particular one. So you just need to be aware that that's an issue. And hopefully just talking to your GP about what formulary they have in the practice, whether they're allowed to prescribe certain ones and why you want that particular one. You should have a useful dialogue with your GP about getting the best one for you.
And I think the other thing to talk about is people get a bit worried about using triptans as they're based on serotonin and using them with other types of medication that also affect your serotonin levels. So specifically antidepressants. GPs and patients get quite nervous about something called serotonin syndrome. So this is actually a largely theoretical problem that's not really been proven in any studies that I've come across, where they worry that if you have too much serotonin on board, you can get some quite horrible symptoms and become quite unwell with it, actually. And there is a theoretical risk of taking triptans with certain antidepressants and actually amitriptyline, which is something we often prescribe for
migraine prevention. Yes.
Yeah. And so there's always that worry where people will say, but this came up as an alert when my GP typed it into the screen. Generally speaking, we say it's safe to use triptans alongside antidepressants, as I've never come across this.
I've never come across it either. And I think because you're only going to be taking taking the triptan occasionally, it doesn't seem to be an issue. So the guidance about how often you should take a triptan is, I generally say, take it on not more than 8 days in a month. I think that's an easy one to remember because that's basically sort of roughly twice a week. But it doesn't necessarily have to be twice in a week. It could be 2 or 3 days in quick succession, as long as your total in a month is not more than about 8. Because, and annoyingly, the very thing that help migraine, if you take them too often, they can give you a thing called medication overuse headache, which is a more relentless chronic headache that comes and is triggered by the triptans themselves.
And I think there are some, obviously they're not the only things that can cause that. And generally speaking, you may find some months that you're taking a few more than others. But I think a rule of no more than 8 a month is a good one to have. And if you're finding that you're taking more than that, sort of over a period of 3 months or more, and that you're actually getting more headaches, it's worth bearing in mind that the triptan could be causing it.
I was giving some advice to a patient recently about this, and she was saying that she was taking sumatriptan, very frequently, practically every day. And we had a chat about it, and she stopped taking them so frequently. And it actually quite quickly, her brain settled down. Her headache stopped, and then she was able to go back to using them intermittently because her brain had cleared from the triptan use. So it is only really probably about 4 to 6 weeks of stopping them. But that we may need to come and get some more specialist help with that rather than just going cold turkey and stopping them. Although some people do that. Yeah,
it's quite funny actually. You saying that reminded me about a patient. I've seen a few patients where their doctors have not quite understood about how triptans are used, and they'll say, well, if you're having them a lot, take it regularly, so take it as like a preventative, and then wondered why that wasn't helping. They should never be used in that way, taken every day to try and stop, apart from that's really specific example we gave for the 5 days of
around the period. The other thing, sometimes quite often hear people saying, I was worried, I knew about medication overuse, so I've started breaking my triptans in half. And we say, please don't do that, because it actually is much more efficient to use a higher dose on day 1, and you're much less likely to get medication overuse than if you use a little bit on day 1, a little bit on day 2, a little bit on day 3. And it seems to be that drip of triptans that irritates the brain over a number of days. Don't you agree?
Yeah, definitely. I think the other thing I wanted to talk about a bit was triptans in pregnancy and breastfeeding, because this is something we get asked about a lot.
Yes.
What do you think about triptans in pregnancy?
I think people have been scared, and of course it's not ethical to be studying pregnant women and trying drugs out on them. So what we do is gather data retrospectively from people who've inadvertently taken the triptans and then found that they were pregnant. And all of that seems very reassuring. So I'm quite happy for people to take their triptans during pregnancy if they need them, with the same rules about, counting carefully on the number of days per month.
Yeah, and I think I'd say with the breastfeeding situation, when GPs or other doctors look it up in our book, the BNF, which has our Bible and applications, it always says that people should pump and dump, is what I think the phrase is.
Yeah, I hate that expression, but I know what you mean. Yeah.
And so they need to express and discard breast milk after they've used sumatriptan. On some studies that we've seen, you don't need to do that.
Quite old-fashioned, I think.
The only one that I would avoid is frovatriptan during breastfeeding, because it's lipid soluble, so it might actually theoretically be around in breast milk, and it's because it's a long-acting one, it stays in the stream for a bit longer. So that would be the one that I would avoid during breastfeeding. So
sometimes migraine does go away very nicely during pregnancy, but unfortunately can return during breastfeeding, so that is a factor. And triptans, let's face it, when they work nicely, they really shorten the duration and the intensity of the pain for a lot of people, don't they? They've been an amazing leap forward.
I think the last thing we wanted to talk about was, what about age-wise? So because a lot of people come to us and they say, my doctor's stopped prescribing triptans because I'm now in my 60s, in my late 60s. What can I do about that? So triptans are only licensed up to the age of 65. And there are some special circumstances where you shouldn't be using them. So if you've got uncontrolled high blood pressure, known recent stroke, uncontrolled sort of heart problems as well. And I think that's largely why they worry about it when you're older. I personally say, if you've been taking triptans safely before that, and obviously this is on an individual basis, have no blood pressure problems, no heart problems, you can cautiously continue to take them.
I think it's hard, isn't it? Because your risk of heart disease increases as as you get older. Some people have a higher risk, of course, if they smoke or have high blood pressure or a family history, or if they have high cholesterol, all of the other things that factor into a risk of heart disease. And we know that triptans work by constricting blood vessels. So that's where the concern is, I think, isn't it?
Yeah.
And so we just need to have a conversation about whether it's safe or not. They're not licensed over 65, but that doesn't mean that we ban them completely. We just need to be thinking really carefully about what we're doing and talking to patients about their individual risks.
Yeah.
What about children?
So children, again, the licensing, we don't do studies on young children. Again, they're licensed from the age of 12 upwards, and it's sumatriptan that's licensed. Is that licensed in slightly younger children, the nasal spray?
Yes, I think it is. And Zomig is in the book as well. So the BNF, you will read sumatriptan and zolmitriptan. But actually, there have been quite a lot of studies worldwide looking at the use of all the different triptans, and they all seem to be safe. Yeah. But I think it is something you definitely need to be speaking to your own GP, or come and see us at the National Migraine Centre if you want advice. We love seeing kids here.
We do.
Get them early, that's our motto.
So I think in summary, what we're saying is triptans are great.
Yep.
You don't just stop at one. If you find that one hasn't worked for you, there are 6 more to try.
Yep, work your way through them.
Absolutely. And think about, you've got a quick, short onset migraine, how long they're lasting, or if it's a slower one, because you may benefit from a slightly longer acting one.
Yeah. So Charlotte spoke to one of our patients about their experience of trying different triptans, and here's what she had to say.
Hi Elvira, thank you for joining us on our podcast. So I know you have an experience with triptans. So what's triptans been like for you?
Yes, they have. I have a real triptan story. I've avoided them for years. I was terrified of the thought of taking triptans. I'd read about them and the fact that they could cause you to have chest pain. And because I'd had episodes of chest pain related to spasms in my esophagus, I was terrified that taking a triptan would bring this pain on. My GP prescribed them for me, and I was still too terrified to take them. I would lie in bed groaning in pain and still be just too scared to take them. I would take the packet out, look at it, and then just put them away again. I just couldn't face it. I also have nausea, vomiting and diarrhea with my migraine, so they can be very severe and go on for 3 days. So I have taken anti-nausea medication as well. So I would try and stick to that on my paracetamol, but usually it was just a case of sticking it out, usually in the bathroom. I then decided that I would try them, and I think I had a little bit of a success, but I did have some chest sensations. I would feel very hot in the chest and not like that at all. So I took them very, very infrequently. I then did go back and see my GP and talk about the nausea and how I was finding it difficult to manage that, and that even if I did take domperidone and Bacostem, I could still find myself vomiting. And then, of course, no medication was helping at all because nothing was staying down. Yeah, so that was really unpleasant. But she did then prescribe me Zomig nasal spray and said to try that. So I did know that different triptans work differently for different people. So I thought, well, I'll give it a go. I gave it a go for a few times, and I wasn't sure that it helped very much. But I thought, well, I am going to be trying this a bit more regularly. So I put in for a re-prescription. I had a note back saying, we're really sorry, we can't prescribe this for you anymore because it's too expensive for the surgery. So, we're giving you Zomatriptan or a dispersible tablets instead. And I thought, that won't work. Yeah. I thought, I can't imagine they'll work. And with these, you open the packet, which is a little bit tricky because the tablet is sometimes a bit crumbly, and you have to open it very carefully and then put it inside your mouth and let it just dissolve there. And they worked. I couldn't believe it, that they actually worked for me. And I didn't have any chest pain. So I felt a lot more confident about using them. And I've probably been taking them now for about a year. Okay. And I've had much better control of my migraines. And then I have a little bit of a magic story too about them, in that I thought all my migraines were these really terrible episodes where I'd be in intense pain and vomiting and have diarrhea. But then I read something about migraines possibly starting in the neck, and that the neck not necessarily being the cause of migraine, but actually being a symptom, the first symptom.
Yeah.
So I thought, do you know what? I'm going to just try taking one of these Zomigs and see if it helps. And it was just magic. I had this pain in my shoulder and my eye, and it went away. And I phoned my sister up and I said, you won't believe this. I've taken a Zomig and this pain has gone away. And then I said to myself, well, it was probably going to go away anyway. Yeah. So I thought, you can't just take Triptans when you've got a pain in the shoulder and a pain in your eye that isn't necessarily migraine. But I tried again, and again it worked, and I only had to have one and it worked. So this was just like unbelievable to me, and it was wonderful. But on the other hand, I also thought, I'm getting more migraines than I thought. Because these were actually migraines, and I'd struggled on at work with them, just thinking I had a pain in my eye or my shoulder or a bit of a headache.
Yeah.
But then I came to realise through trying the Triptans for them that they were actually migraine, and that this Triptan worked. Now, when I get one of my what I call traditional migraines, I now take an anti-nausea drug called domperidone and the Zolmitriptan at the same time. And usually I find that reduces the migraine. It doesn't necessarily take it away, but I'm in much less pain than I was before. So I'd probably maybe rate it a 6 or a 5 instead of a 10. And I usually find when I'm having one of these traditional full-blown migraine attacks that I need to take a second one 2 hours later. And that does work. And helps keep the worst symptoms at bay. So I found that really successful. And finally, at the age of 60, after having migraine since the age of 11, I now have something that can sometimes stop it completely, and on the other hand, really helps. And after my visit today, I've got some other things to try, so I'm really feeling much more hopeful about migraine than I ever have in the past, and I'm really grateful to the migraine clinic for giving me all those suggestions.
That's fantastic. So Triptans for you.
So Triptans for me. After all that fear about taking them,
sometimes you have to just try.
Has in some ways really helped me get some control with some of my symptoms. So
that's fantastic.
That's really good.
Well, thank you for sharing your story with the podcast. I think everyone will really enjoy that. So thank you very much.
And thank you for helping me.
Our next Heads Up podcast is focusing on migraine prevention, specifically lifestyle management.
You've been listening to the Heads Up podcast. If you want more information or have any comments, email us on info@nationalmigrainecentre.org.uk. Till next time.